An arthroscopic capsular release is an operation we use to treat frozen shoulder that has been resistant to non-operative treatment. We usually perform this awake under regional anesthesia, but sometimes can do the operation under general anesthetic. If we're doing this awake under regional anesthesia, the anaesthetist will numb your arm. We'll put a camera into the back of the shoulder joint and have a look inside the joint to confirm the diagnosis. We then make a small entry at the front of the joint and clear away the scar tissue that's causing the condition. We may put steroid into the joint after the operation to try to reduce the risk of recurrence. Dressings are applied over the stitched portals, and you're in a temporary sling for the first 24 hours after the operation. It is key with this operation to get back to activity as soon as possible, so the physiotherapist will see you on the ward before you go home to demonstrate exercises that you need to start doing the day after surgery. Once the block has worn off and the arm is back to life, the sling needs to come off and go in the bin, and you need to start using the shoulder straight away. And I recommend getting booked in with a physiotherapist within a couple of days of your surgery to start your exercises to prevent the risk of recurrence. Sutures are usually removed 2 weeks after the operation. You can get back to driving and normal activity as soon as pain has settled and you can control a car comfortably. And I expect that most patients will be much better and ready to be discharged from clinic by about 3 months after the operation. The risks of an arthroscopic capsular release include bleeding, but this is low risk with keyhole surgery. Risk of infection should be less than 1%. And risk of damaging nerves is low, although there is a major nerve that runs just under the shoulder that we have to avoid during surgery. There is a chance of persistence of symptoms. We should increase your range of motion considerably from what it was before the operation, but it's never 100% because the disease covers some of the normal structures and we can't take all of it away. There is a risk of recurrence. The body heals by forming scar tissue, so from day one, after we've cleared the scar tissue from frozen shoulder away, your body is going to try to replace it with new scar. And so it's important to use the arm and get it moving so that that new scar tissue is stretchy enough that you can get the arm into the positions necessary for function. There will be some residual stiffness, but hopefully the shoulder should be much more functional. With any operation, there may be risks that are specific to you, in addition to the risks described, and we'll discuss this in clinic prior to your operation.